Because there's been an increase in diagnoses of colon cancer, I talk about ways to reduce risk of colon cancer through nutrition and lifestyle. But now I want to talk about the symptoms of colon cancer. There's 6 of them. The first one, the most important one, is a change in your bowel habits. And these are going to be, you're going to notice, okay? It's not going to be like an illness of, diarrhea or constipation in a pretty excessive way. It feels different going to the bathroom. It's feeling this way for a long time. Your patterns are just a lot different. It's going to be different than anything else you've experienced in your life. So if you've gone through illness or bouts of constipation or bouts of diarrhea, it's going to be a lot different than that. You're going to notice it for an extended amount of time. Okay. If you're going to the bathroom, if you're having bowel movements and they're really different for an extended period of time, you need to go see a GI doctor. Number 2 would be rectal bleeding or blood in the stool. Again, sometimes, like if you have anal fissures or hemorrhoids, there can be blood per rectum when you have a bowel movement. It's different. What the blood I'm talking about, it's different. This is where you have your stool is just a different color because there's blood in your rectum or in your colon. So your stool color will be a lot different. Your stool color can change. It can change with the foods that you eat. Okay, for example, like if you have like something with food dye, you're gonna have a bowel movement that's gonna be the color of that food dye of like frosting, because I've had people share that. They're like, oh my gosh. Okay, but blood in your rectum or your colon will produce a darker stool color. Unfortunately, there's also other blood droplets that could be in your stool. It could be in your stool, but it wouldn't be detected unless it was like looked at in a lab. Also, one thing to add, like if you have like anal fissures or hemorrhoids, you would have flare-ups where there would be bleeding because of the flare-ups around those. Whereas if it was attributing to a symptom of colon cancer, the blood would continue. It would continue on, and it wouldn't just be with those hemorrhoid flare-ups. Another one would be your bowels doesn't feel like they're completely empty when you're going to the bathroom. That could be a symptom of colon cancer. If you're having bowel movements regularly, but the feeling, it just doesn't feel completely emptied, again, call your doctor. Another one is, and again, you want to go see your doctor if you have ongoing abdominal pain or gas. And it's different than like if you are constipated or if you have some certain like high gas foods, or greasy meals or things like that are going to produce discomfort in your abdomen or a lot of gas, something that's not going to be able to resolve within a day. Okay. So something that, again, it's really ongoing. You want to consult your doctor. Another one would be weakness and tiredness. And also please note that a lot of these would go together. So I know as people who are worried about sickness, or if you're a cancer survivor and you're worried about recurrence, some of these, might just be day to day. Maybe you just didn't get very good sleep one night. Maybe you're at the end of the work week and you're exhausted and now you have weakness and fatigue and you're thinking about this video that I'm doing right now and you're like, oh my gosh, she said weakness and fatigue can be a sign of colon cancer. And then you're worried it's coming back. Yes, weakness and fatigue can be a sign of cancer being present, but there's going to be other side effects. And symptoms. And one of those symptoms, the last one that I want to mention, is unintentional weight loss. I see this often. So if unintentional weight loss, abdominal pain, blood in your bowel movements, change in bowel habits, and fatigue and weakness, that altogether is, it's probably a symptom of colon cancer. Again, see your doctor, have them assess it. These are some symptoms to keep in mind, but it's always best to go to your doctor and get checked. And if you want to learn more ways to reduce risk of colon cancer, check out my recent content and hit follow to learn more.